Good afternoon, Mendez Dane. I am Mihiraa. Let's start the warm-up session. Tell me what you feel your greatest skill as a doctor is.
As a doctor, I believe my greatest skill is my ability to communicate effectively with patients. I can explain complex medical concepts in a clear and understandable manner, ensuring patients are well-informed and involved in their healthcare decisions. Additionally, my empathetic approach allows me to connect with patients on a deeper level, fostering trust and rapport. By prioritizing clear communication and empathy, I can provide personalized and compassionate care tailored to each patient's needs.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
How do you communicate with patients effectively as a doctor?
To communicate effectively with patients, doctors should prioritize active listening, empathy, and clear language. Establishing rapport and trust by demonstrating genuine care and respect is crucial. Using plain language and avoiding medical jargon helps ensure patients understand their diagnosis and treatment options. Encouraging questions and addressing concerns promptly fosters a collaborative relationship. Follow-up communication ensures patients feel supported and informed throughout their healthcare experience.
Describe your ability to handle high-pressure situations.
My ability to handle high-pressure situations as a doctor is grounded in experience, preparation, and resilience. I remain calm and focused and make quick, informed decisions, prioritizing tasks and ensuring clear communication for efficient teamwork. Additionally, I prioritize self-care to recharge amidst demanding circumstances. I view high-pressure situations as opportunities to showcase my skills and dedication to patient care, adapting effectively to ensure the best possible outcomes.
How do you deal with someone who isn't satisfied with your patient care?
When a patient isn't satisfied with my care, I listen attentively to their concerns and validate their experience. I address their specific issues transparently and offer alternative solutions if possible. Open and respectful communication is key throughout the process to foster trust and understanding. My goal is to ensure the patient feels heard and valued, working together to find a satisfactory resolution.
You can now start your OET-speaking roleplay.
Well, Mihiraa, thank you for allowing me to examine you. I understand you've been having some trouble with your throat after eating fish a couple of days ago. Can you tell me exactly when the pain started?
Yes, it started during dinner 2 days ago when I was eating the fish. It felt like something got stuck in my throat right away.
I see. Based on my examination, I'm happy to report that your throat seems clear. I didn't find any bone stuck there. It's possible that when you swallowed the fish, a bone might have scratched your esophagus, which can cause inflammation and swelling.
But it really feels like there's a bone stuck in there. It's been very uncomfortable, and no matter how much water I drink, it doesn't help. Are you sure there's no bone?
Mihiraa, I understand that it feels like there's something stuck in your throat and that it's very uncomfortable. It's quite common to have this sensation if there's been a scratch in the esophagus. Even though it can feel just as painful and irritating as if there were a bone there, the fact that I didn't find any bone during my examination is reassuring. A scratch can mimic the feeling of having something lodged in your throat, and this discomfort can last for a few days while your body heals. I assure you that it's very unlikely that there's a bone still caught in your throat.
How can you tell that the bone isn't there, though?
That's a good question, Mihiraa. Based on my examination, I didn't see any signs of a foreign object. Plus, if there were a bone caught in your throat, you would likely experience more severe symptoms. These could include vomiting, significant difficulty swallowing, or even bleeding. During my examination, I looked for any signs of these issues and didn't find any evidence of a bone. The symptoms you're describing are more consistent with a scratch, which can be very uncomfortable but is less serious.
Will it get better soon? It's really very uncomfortable.
Mihiraa, I can see how uncomfortable this is for you, and I'm really sorry you're going through this. The positive side is that this kind of discomfort typically resolves on its own. As the inflammation from the scratch in your throat decreases, you should gradually start to feel better. For most people, the irritation significantly improves within a few days. To help soothe your throat in the meantime, try to eat soft foods and drink plenty of fluids. This can make the healing process a bit easier for you. If you have any concerns or the discomfort persists, we're here to help.
What if it didn't subside?
Don't worry, Mihiraa. If the discomfort doesn't subside within a few days, we have additional steps we can take to ensure everything is okay. We can perform an X-ray to check for any foreign objects that might have been missed. If necessary, I can also refer you to a gastroenterologist for a more detailed examination. We'll make sure to get to the bottom of it and provide you with the care you need.
Okay, I hope it gets better soon.
Of course, Mihiraa, let me summarize what we've discussed to make everything clearer for you. During our consultation, I carefully examined your throat after you mentioned discomfort following your fish meal. I want to reassure you that there's no bone lodged in your throat. It's possible that you have a scratched esophagus, leading to inflammation. Despite your ongoing discomfort, I didn't observe severe symptoms that would suggest a bone, such as vomiting or bleeding. You can expect gradual improvement as the inflammation decreases. In the meantime, try sticking to soft foods and drinking plenty of fluids for relief. If your symptoms persist, don't worry. We can consider further steps like an X-ray or referral to a gastroenterologist to ensure you receive the best possible care.
Thank you for explaining everything, doctor.
You're welcome, Mihiraa. If anything changes or if you have any concerns, don't hesitate to come back.